this could be. Looks like it. All right. Hey, everybody. This is Sean Fogel here, Field Director, Connecticut Rivers Council, and I'm joined by Dr. Jeremy Stricsek, MD. Hey, Jeremy, how are you today?
Hey, Sean, I'm doing really well. How are you doing today?
I'm better now, brother. Better now. So
Me
I'm
too.
just,
Good to see you.
yeah, you too, man. I hope all is well and you're hanging tough up in your neck of the woods. But thanks for agreeing to do this with me here. We represent about 13,000 scouts and their
Wow.
families in the greater Connecticut and Hartford area. We cover about 75% of the state of Connecticut. We have a lot of people probably watching. We got a lot of buzz on this event, so we're just excited you could join us for this afternoon.
Well, thank you very much. I'm very excited to be a part of this. It's also special for me because I'm originally from Connecticut and I got my scouting start in Connecticut. So it's cool to be coming full circle finally.
Yeah, that's awesome. Yeah, we'll chat more about that too. But it's good to know. So Jeremy, let's start off with the basics. Who are you and what do you do, brother?
All right. My name is Jeremy Stricsek. I'm a family doctor and I live and work outside of Boston, Massachusetts. I've been a family doctor for about, how long now? 7 years. And yeah, it's been great. It's a good job. It's a very satisfying job. And in that role, I do a little bit of everything. And fortunately and unfortunately, that has prepared me well for what's going on right now.
Let's talk a little bit about your background. You said you practice up in Boston, but is there a hospital, Cambridge? Is that right?
Yes, I work for Cambridge Health Alliance. It's two hospitals and a collection of outpatient clinics serving the greater Boston area, primarily north of the Charles River. So a lot like Cambridge, Somerville, Everett, Chelsea, all those surrounding towns are our main catchment and care area.
And what's your background? Where'd you go to school at?
So I kind of lived all over. I was originally from Connecticut. I lived in Illinois, Michigan for a while. Grew up in the Pittsburgh area, which is how I came to know you.
Yep.
And then in 2005, I moved to Rhode Island. And in Rhode Island, I did my college, medical school, and family medicine residency all at Brown University in Providence.
Providence.
Mm-hmm.
Okay. What was the medical school? What was it called? Remember?
Oh, I think the official name is now Warren Alpert Medical School of Brown University. But we still called it Brown, yeah.
Sure, I got you. Mm-hmm. Yeah, and you did your full term there, right?
I did, yeah. 11 long years, and I think as Connecticut being close to Rhode Island, a lot of people from Rhode Island don't leave there. So I was there for a long time. Sure. Really got in that mindset of not traveling far, and really loved it. But I'm loving where I am now too.
Yeah, great. New England's just awesome place to live, and I've lived here up with my with my wife for almost 8 years now. So we're excited to be up here in this area as well.
Excited to have you here.
Yeah, that's right. It's a great place. Great medical facilities, and it's just good comfort level here with that. So, so I do want to talk. Like you mentioned, you were a scout here in Hartford, New Hartford, right? Is that right?
Yes, New Hartford. Yeah, okay. I was a Tiger Cub and a Wolf Scout.
Okay. So let me. So I did talk with your parents. Let me see if I can bring it up here. I did talk with, oh shoot, oh, I can't do that. I can't figure this out. Hold on.
My parents found a lot of good pictures while they were looking for these, so thank you.
Oh, so you talked to them about this?
They mentioned it briefly. I don't know which ones they finally selected, but yeah.
I can't seem to do it while I'm recording. Let me see here. Let's try this. No, it's not working. It's not letting me do it. I'll have to share them later at the end, Jeremy. I apologize.
Okay, that's good. I hope there's one of me looking really sad after a Pinewood Derby.
Well, let me try one more thing here. Yeah, I have these. I asked Ernie, your dad, for a couple of these on LinkedIn, and I was like, let me give it a shot and see if I can find some old embarrassing pictures of you as a scout growing up. But let's see if I can screen share it here. All right, let me see here. It's not playing nice for some reason here. There we go. There we go. Look at that handsome guy.
Oh, yeah. That was me volunteering at the local historical museum when we lived in Michigan.
Yeah. So that
Yeah,
you're part of the Gerald Ford Council, is that right?
exactly. The
Yeah.
Gerald R. Ford Council. And that's when I was a Boy Scout. I was probably probably first class scout at that time.
Yeah.
And yeah, volunteering and doing a tour for some of the tiger cubs there.
Yeah. And how about this guy? Can you see this one?
Not yet.
Not yet. All right, hold on. I don't know why this picture was taken in the 1860s, but nonetheless,
Yeah, exactly. Yeah. Very, very early days of scouting.
I
Oh
like.
man, that's it was the '90s. It was a different time because you
Sure.
could have meetings everywhere.
Gotcha.
And I had that police car, Pinewood Derby car, for a very long time. I remember really
Sure.
loving that. That was a great toy even after the racing.
Sure. All right. Well, yeah. So I just wanted to share that with some embarrassing pictures. But
Thank you.
did you always know? Let me ask you just general. Did you always know you would want to be a doctor, or when did you decide to do that?
I probably when I was a freshman in high school is probably when I really
Okay.
just thought that that was what I wanted to do. And then ever since I've been really interested in that. And now that I've been doing it for all these years, can say I'm very, very happy with my choice and I chose the right field for me.
And when did you decide to be a family practitioner or family medicine?
That took a while. That was probably towards the end of my third year of medical school. And medical school is typically 4 years. So, kind of right around the transition between third and fourth year, I felt that that was the best fit for what my interests were.
Gotcha. All right. Well, yeah. So let's get into it if you don't mind.
No, please.
So we have this, public health crisis. So all of our scouts have been, social distancing. They've been
Good.
trying to stay home as best they can. But they're kind of, we're scouts, right? So we want to explore the great outdoors and, physically
Mhm.
strong and, mentally strong and physically fit's kind of a motto of ours in our scout oath. So
Yeah.
I wanted to talk about. So let's talk about some just practical do's and don'ts of COVID-19 here. What can our kids do to, maybe some myths debunked or anything like
Mhm.
that would be helpful, I think, to our families.
Sure. I think the first thing that comes to mind is a don't, and this is going to be a little bit of a weird thing to say, but I will explain it. But I think I would say don't watch too much news or spend too much time on the internet reading about it right now.
Mhm.
It's extremely important to stay informed. And while there certainly are new things coming out all the time, I think a lot of the news cycle has been focused on how really terrible this virus has been. And while it really has done really awful things, we also need to be doing other things in our lives. And if you're spending all day just focusing on the bad news that's coming out, it can be really paralyzing. It can be very easy to get anxious, very easy to panic. So I think picking times where you're going to update yourself about what's going on and being a careful consumer of what's coming out so that you can stay informed but not get overwhelmed by what's going on.
Hmm. That's yeah, great advice. I know it's easy to, the news cycle moves so fast anymore.
It sure
It's
does.
hard to keep up. So when you don't want to be ill informed, like you mentioned, but yeah,
Exactly.
you can get doom and gloom pretty quickly, and it's important to stay positive too, right? The right mindset for this is probably just as important as anything else that we do, I'm sure.
Absolutely. Yes.
So it's, besides, I mean, everything we've heard, right? Social distancing, wash
Mhm.
our hands, stay indoors if you can. Is there anything else that we should be doing or practicing in our lives?
Yeah, that's a great question. And I mean, I think you've really hit the big things, and I guess I'll talk a little bit more about all of those. So I think we've all heard about social distancing. Now we know that the main thing is if we are outside of our home, then we need to try to stay about 6 feet away, at least 6 feet away from other people. And the reason we do that is the COVID-19 virus is not an airborne virus. Airborne means it just is kind of available in the air all over the place, but it is passed by what are called droplets. So imagine every time you sneeze, I think is probably the best example. You sneeze into your arm. Don't sneeze into your hands, okay? But you sneeze into your arm, you feel how wet your arm gets. Kind of gross, honestly. But those droplets carry the virus, and coughing and sneezing can transport those droplets about 6 feet or so. So that's
Okay.
where the idea of staying 6 feet apart is that if someone is coughing, sneezing, whatever, those droplets can't make their way and land on you.
Gotcha.
Yeah, other things. So in Massachusetts right now, I'm not sure what they're doing in Connecticut, but the state has recommended everybody wear a mask now when you're
Yeah.
outside.
Connecticut state guidelines is you have to wear one outside
Oh,
now.
okay, terrific. Yeah. So, and the idea behind the mask, there are many different types of masks. I think we all have learned, N95 is a vocabulary word that we've all learned now that many of us never hoped to know about, honestly. But
Sure.
even the very basic masks, like the surgical masks, which are just the ones that go over the ears, the idea behind that is the same type of thing with those droplets. If you have the mask on and you're coughing, the cough can't go anywhere. It's not going to get other people sick.
Mm.
Same thing, someone somewhere else is coughing, wearing it, it's harder for it to get on you. So um, the masks are in part to keep us safe, but also everything that you're doing to keep yourself safe, it's very important to remember that you're keeping everyone else safe as well. So
Mm.
every step you take, you're really doing for everyone.
Okay. Yeah, it's great. I know, our scouts down here have been doing just awesome stuff for the local communities. And every time there's a crisis in humanity or in the country, the scouting world has actually taken a big step forward, and to really help these communities. At our camps, we're printing N95 masks for 3D from 3D printers. We're
Wow.
donating them. We have scouts sewing masks in our state and donating them to the local communities. We have local food drives going on. So we've just been doing a bunch of stuff, and I think we hope it lands in the right place and actually does some good. So we want to thank you for being a doctor and a frontliner, and really appreciate you doing all the work you're doing for the citizens and for to keep us to allow us to do our stuff at home. So we appreciate that.
Yeah, well, and thank you, and thank you to all the scouts who are making masks and doing the food drives, because really all those things you're doing, that those are really life-saving tools. You are keeping all sorts of people safe. You are keeping people alive. And actually, just you mentioned not being on the front line. This it's not an original thought. I heard it from another doctor, I think down in Georgia, and unfortunately I forget her name, but she made this great statement that we as healthcare workers are actually, while we appreciate all the thanks and the respect everyone is providing, we're really the last line of defense.
I see.
Actually, it's all of you out there who are really the front line in this. And then you are making the difference with your social distancing, with your hand washing, with your mask using. And then you have all gone above and beyond by making masks, by getting involved and finding other ways to help out. So really, what is getting us through this pandemic is the work that all of you are doing. So we are really all in this together. So thank you all for everything you've done so far and all that you continue to do.
Yeah, no, yeah. Families appreciate that. We appreciate that. I do have this might be more personal than most, but any tips on how to stay healthy at home? I know my refrigerator, when I opened it the other day, said, "What do you want again?"
Yeah, see, it's your back. Yeah.
So, is there any tips on to stay healthy at home? Just stay active as best you can? Or
Yeah, that's a great question. I think, yeah, I mean, staying active is, some of us are very lucky. We have yards, we have some outdoor space we can go
Sure.
out into. Not everybody has that. We recognize that. So I think trying to find ways where you can keep your blood flowing, whether it's doing jumping jacks or going on YouTube or TikTok or something and seeing some home exercise routines, just to do some like light aerobic activity. Because like you mentioned, especially with the scouting population, you all love being outside, you love hiking, you love being active. And a lot of what's going on right now is really counter to what we all really enjoy doing.
Yeah.
But I think also continuing to do other things that you enjoy, and that you're able to do while being inside. And then just making sure you check in on your loved ones and on your family who you can't necessarily see in person, whether it's calling, writing, or using your social media of choice. Reaching out to people helps us stay connected. And we're really lucky that right now in the 21st century, even though we're all staying at home, you and I can have this conversation right now. We're not being isolated. So.
Yeah. Yeah, that's good. And yeah, no, some has been made, but probably not enough is the mental health, right?
Yeah.
Our extroverts need to check on our introverts need to check on the extroverts and
Absolutely.
vice versa, just to make sure everyone's sanity is still in check while we're kind of bogged down at home. But yeah,
Totally.
so I mean, I'm good. Did you want to add something else, Jeremy, or any other messaging? Or
Let me see. I think those are the big things. I guess there's one thing that I think just one thing that's come up a number of times I've seen in the news is there's been a lot of questions about whether or not medicines like ibuprofen are safe to take right now. And I guess want to comment that. So ibuprofen is the active ingredient in Motrin, Advil medicines like that. It's also
sure.
available as a generic. And I just want to say that medicine is safe to take. There was some concern that it may have made COVID virus worse in some cases, but that really has not been proven.
Gotcha.
So a lot of my patients have said to me, "Oh, doctor, I hear that ibuprofen isn't safe, so I've stopped taking it." I just want people to know that it is safe to keep taking it.
Okay.
And then there have been some other questions about some blood pressure medicine. So I would just say, talk to your doctor before making any changes.
Gotcha. All right. No, that's great tips. I have one thing for you, man. So we just announced late last week and early this week that, we have Council shoulder patches, right?
Ooh.
And we just came up with a new one that will benefit, half the proceeds will benefit COVID fighters, so supporting the COVID fight. And dude, I just want to let you know, I bought one and I got it in your name, man, and it'll be sent to you.
Thank you. I look forward to that.
Let me show you what it looks like here, buddy. There it is, right there. Scout is helpful, Connecticut Rivers Council. So I
love
bought one on your behalf for talking with us and helping us out today. And I'll send it to you when I get a chance, brother. All right.
Thank you very much, Sean. It was a pleasure to talk with you. Thank you for all that you're doing. Thank you for organizing this. Keep up the great work.
All right. Thanks, Jeremy. I'll talk to you later, buddy. I appreciate it.
All right. Talk to you.